Around 3,000 students graduate from nursing school in Wisconsin every year. But according to the state's Center for Nursing, that will soon be nowhere near enough to address a big shortage. News 8's Kyle Dimke joins us in the studio with more.
In just 20 years, the center predicts Wisconsin could see a shortage of 20,000 registered nurses. There are a few reasons for the shortage and no quick solution.
Being a nurse takes a special type of person.
Somebody who really is compassionate, somebody who enjoys being a nurse and who has a big heart.
That type of person is going to be in high demand over the next 20 years. According to a report from the Wisconsin Center for Nursing, the state's RN workforce is about to see a sharp decline. In addition, the number of people that need care is increasing. In the next few decades, that number will grow more than 100%. And the industry is already feeling the hurt.
And the demand there is out there for nurses, whether it's nursing assistants, LPNs, or RNs.
According to the report from the Wisconsin Center for Nursing, 26% of Wisconsin nurses plan to leave patient care within the next 2 to 9 years. Another 43% after 10 years.
I think if that does happen and does occur as predicted, then I think the rural facilities, like our facility here in Tomah, will be impacted.
Local medical centers might bear the burden of that hurt.
Because we don't have the ability in all cases to compete with some of the larger urban facilities, healthcare facilities.
The Tomah VA's medical director says rural areas will need to find ways to attract nurses to their hospitals and clinics.
The way we compensate for that is to try to offer recruiting and retention incentives, and also to try to be more up close and personal with those that may be interested in employment.
Providing great care is caring about the person, the family, and also just having solid nursing skills.
As demand for nurses continues to grow, nursing students with that particular personality and skill set may find securing a job after college won't be too difficult.
By the year 2035, the Center for Nursing expects to see a 123% increase in people who need care as the baby boom generation retires.
Thanks, Kyle. According to the center, the nursing shortage will only get more complicated as current RNs who teach in nursing schools will also reach retirement age. Well, the Tomah Veterans Hospital is addressing its own shortage today. The hospital hosted its first nursing career fair, targeting registered nurses, licensed practical nurses, and mental health nurses. All are positions the VA has had trouble filling in recent months. Hospital staff were on hand to answer questions, and they asked applicants to bring along their resume, and they even offered on-site interviews. Officials say it's the first time the VA has used a fair to attract potential employees, and they're excited to try the new hiring process.
This is more of a personal touch because candidates can meet the staff that work here presently, ask any questions, actually see the units and meet the nursing managers as well.